As the number of COVID-19 cases continue to rise globally and here in Guyana, we encourage everyone to practice social distancing. Remember, wash your hands thoroughly and frequently and wear your masks as we strive to stop the spread of the virus. Welcome to InfoHub for Wednesday, April 15. Thanks for joining us. With the number of confirmed local coronavirus cases reaching 48 as at April 14, the Public Health Ministry has provided a breakdown of the regions where these cases have been recorded. Details in this Delicia Haynes report.
The update provided by the Public Health Minister on Tuesday clarified that 44 of the 48 confirmed cases are local transmissions, while the other 4 were imported cases. Majority of these cases are in Region 4.
Our confirmed cases in Region number 4, representing 86%, are as follows: 14 from the East Coast Demerara, 5 from the East Bank Demerara, and 17 from Central Georgetown. Regions 1 and 6 with 2% each, and Regions 3 and 10 with 5% each. To date, 60% of those tested positive are males and 40% females.
With these numbers in mind, the ministry, through the Health Emergency Operations Center, continues to do contact tracing in an effort to contain transmission and safeguard the at-risk population. Those who might have been in contact with a positive case are immediately quarantined and subjected to testing according to World Health Organization guidelines.
The total of 224 persons tested during the period 26th February through 14th April 2020. Those who have tested negative are 176, and 8 persons have recovered.
For InfoHub, Delicia Haynes.
Meanwhile, the Civil Defense Commission, through its National Emergency Operations Center, met with members of the private sector to continue collaborative efforts to aid in the fight against COVID-19.
The virtual meeting primarily focused on the private sector's efforts to aid in the fight against the presence of the coronavirus in Guyana. It saw representatives of the Private Sector Commission, the Guyana Manufacturing and Services Association, and the Georgetown Chamber of Commerce and Industry, along with the NEOC providing updates on several initiatives. These include the distribution of sanitization supplies to aid cleaning of markets, mobilization and importation of supplies, and the distribution of hampers to households in vulnerable communities. Chairing Wednesday's session was CDC Senior Response Officer Captain Salam October. The CDC representative provided clarity of the distribution exercise, explaining how the Commission determines where the distribution takes place. According to him, a number of factors are taken into account, such as the loss of income, prevalence of unemployment, and the number of single-parent households in a community. It was noted that while there is a belief that the pace of the Commission's distribution exercise could be increased, persons must be cognizant of the fact that the Commission had the foresight to procure supplies before the situation drastically changed from then to now. Captain October also disclosed that the Commission has several distributions planned and will be executed shortly. Members of the private sector also expressed satisfaction to be actively engaged on the national issue. For InfoHub, Anara Khan.
More COVID-19 news. The Public Health Ministry is seeking to adopt additional methods of testing for the coronavirus. There are plans to expand those services to the laboratories of some private medical institutions. Kellon Rover brings the details.
Currently, several private medical facilities can take samples as they were provided with the required kits, swabs, and forms for patients to fill out as part of the initial stage of testing. Chief Medical Officer Dr. Shamdir Prasad said the ministry is working to establish a network of laboratories across the nation with quality assurance. Dr. Prasad was speaking during the NCN program COVID-19 Conversations, aired on Sunday evening.
The situation is becoming worse. We are looking at additional methods of testing for COVID-19 and to expand those within some of the private institutions and the standalone laboratories. So hopefully they wouldn't just take samples and send them to the public health lab, but take samples and test them. The system we're working on will be for a quality assurance system.
The senior medical official also disclosed that some of the private health facilities lacked the required capacity for isolation units and adequate personal protective equipment.
The work has been ongoing with the private institutions. Most of them have capacity issues, with what is required is for isolation area, for all the adequate personal protective equipment. The level and use of those have been challenging some of the private institutions, but we are working with them.
Additionally, the Public Health Ministry is seeking to ensure that there are adequate stocks of personal protective equipment, particularly for health workers attending to COVID-19 patients.
We were able to, with some assistance that we have received so far, with some purchases, with the donations from Pan American Health Organization, and we have even repositioned some of our supplies. When we had the histoplasmosis outbreak, as you recall, the Chinese authorities did donate quite a few of the hazmat suits. Those are the complete coveralls from head all the way down, and then you would have to use a face mask, a N95 mask, along with eye shields and boots cover to complement that, so that you can have complete protection against any possible exposure. We were able to redistribute those adequately.
Dr. Prasad said the Health Ministry is working closely with the Ministry of Finance and some other donors to see how best it can keep those stock levels up. Reporting for InfoHub, I am Gellon Rover.
We now turn our attention to news from GCOM. The Guyana Elections Commission says it has re-invited CARICOM to be present when the Commission undertakes a national recount of the March 2, 2020 votes. Commissioner Vincent Alexander says that GCOM has already contacted CARICOM and is awaiting a response. He reminded that CARICOM will not be undertaking a supervisory role of the process, as it is only GCOM that could carry out that function. Alexander clarified that the regional body will only act as a third party to give credence and credibility to the process. The team also conducted a site visit to the proposed location, the Arthur Chung Conference Center, today. More news after this short video of some do's and don'ts you should follow to keep yourselves and families safe during this time. Stay with us. Welcome back. Let's tell you now that the World Health Organization is cautioning countries about lifting restrictions too quickly, noting that this could lead to a deadly resurgence of COVID-19.
The World Health Organization has advised against the planned transition out of the stay-at-home restrictions in some countries. WHO Director General said that the organization is working with affected countries on strategies for steadily and safely easing restrictions. He noted that several factors have to be studied, and I quote, that transmission is controlled, sufficient public health and medical services are available, that outbreak risk in special settings like long-term care facilities are minimized, that preventative measures are in place in workplaces, schools, and other places where it is essential for people to go, that importation risk can be managed, and that communities are fully aware and engaged in the transition. End of quote. The Director General said that WHO will continue to do its part in providing assistance to countries where they are most affected by this crisis. WHO and the World Food Programme will be organizing a new initiative, United Nations Supply Chain Task Force, that coordinates and increases the purchasing and distribution of personal protective equipment, lab diagnostics, and oxygen to countries that need it the most. Globally, nearly 1.5 million confirmed cases of COVID-19 have now been reported to WHO, and more than 92,000 deaths. Sneaker Thorne, InfoHub.
Guyana Rice Development Board General Manager Nizam Hassan says the agency is confident of an excellent rice production this year in spite of the novel coronavirus pandemic.
Speaking with InfoHub during a virtual meeting on Wednesday, the general manager said with the production GRDB plans to achieve this year, it is confident that there will be adequate supplies for local, regional, and extra-regional markets.
We don't expect that there will be any fallback from our projection. And so for this year, just as we had done last year, we expect that we'll get over 1 million tons of paddy this year, which will be close to 700,000 tons of rice equivalents.
According to Hassan, while there have been some shortcomings in a number of countries due to the current pandemic, other markets are relatively stable.
Our exports to Latin America rose. And in fact, we had an overall increase of 40% in the exports to Latin America. And this is primarily contributed because of the jump in our exports to Venezuela. So we are doing well in our exports to Venezuela. Last year we did at this time 15,106 tons compared to 24,653 tons. Quarter to quarter compared. So whilst there has been a fallout in some of the markets, and some of it is linked to COVID, and some of the markets is stable. There's no significant increase or decrease in the demands.
Due to the reduced working hours at government agencies, Hassan said his agency has advised rice millers to contact the agency early in relation to their documents. He explained that the agency's extension services continue to operate, but by an on-call and rotational basis. Extension officers are in constant communication with farmers to get harvesting data, and should there be an issue, advice can still be sought. For InfoHub, I am Kellon Rover.
Remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical attention early, but call that hotline first. That's all for today. Connect with us on our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your bridge and weather reports are up next. Stay safe. Goodbye for now.